Hi, my name is Darren. I'm with rebootcongress.blogspot.com, and
I'm Sidney Watson, and I teach at St. Louis University in the Center for Health Law Studies.
Okay, and I wanted to talk to you, Sidney, about my concern about whether or not we would have legal recourse under the new healthcare legislation to go after whatever health bureaucracy is put in place. Specifically, my concern is whether sovereign immunity would protect the bureaucrats that would be administering the new healthcare system.
Well, I think your question probably misunderstands the system that the bill would set up. The part that would be government administered would simply be setting the rules. We would still have private insurance companies. Care would be delivered by private hospitals, private doctors, just in the same kind of practices there are now.
But wouldn't there be a government option as well in the bill?
But the government option really only means a government financing mechanism like we have now in traditional Medicare, where the government collects money and then pays the providers. Actually, the government pays private insurance companies who then pay providers.
Well, taking that angle, the last person who spoke was talking about some fraud that was occurring within the Medicare system using the coding system
Well, actually, I think the fraud he was talking about is concerns throughout medicine. Also, private insurers report a lot of fraud. Where we have effective fraud laws now are with Medicare and Medicaid. So actually, this new bill would make it easier for us to investigate fraud and to prosecute those who are engaged in fraud.
But do you see any risk from the administration of those, the financial side of it? Would we be able to, like, if they're denying coverage, would we be able to sue the government at the end of the day?
Well,
you're sort of saying that you don't think that.
If your concern is providers who are engaged in fraud, those providers will have the same corporate status they do now. They are private, they are either individual doctors.
My concern, though, actually isn't so much with them, it's with the government, and if there's a government option, whether or not they'll be able to essentially shield fraud, waste, and abuse using the legal system and essentially denying people who are insured the legal recourse.
No, actually they would have the same incentive the government has now to prosecute Medicaid fraud and Medicare fraud, but there has actually been quite aggressive enforcement. Where we're lacking the legal tools right now are in the private sector.
Okay. Thank you for your time, Sidney.
Yeah.